Hello everyone. Today, we the clinical instructors along with the students of Holy Family Institute of Nursing Education would be demonstrating how to check the vital signs of the patient. Definition: Vital signs are the evidence of the current physical functioning of the body. They provide critical information that is vital for life, and so they are called vital signs. Articles: a clean tray containing soapy swab, wet swab, dry swab, thermometers such as rectal thermometer, oral thermometer, axillary thermometer, wristwatch, pen, lubricant jelly, small towel, sphygmomanometer, stethoscope, kidney tray, paper bag, TPR chart. The first procedure is checking the temperature. Explain the procedure to the patient. Wash hands. Oral method. Clean the thermometer in circular motion from bulb to stem by soapy swab, wet swab, and then dry swab. Shake down the thermometer till the mercury level comes 35 degrees Celsius or 95 degrees Fahrenheit. Place bulb of the thermometer at the base of the tongue on side of the frenulum in the posterior sublingual pocket. Instruct patient to close the lips and not to bite the thermometer. Leave thermometer in place for 2 to 3 minutes. Clean the thermometer in circular motion from stem to bulb by soapy swab, wet swab, and then dry swab. Rectal method. Provide privacy to the patient. Place the patient in side-lying position. Expose the rectal area of the client. Wear gloves. Apply lubricant on the bulb of thermometer using cotton balls. With non-dominant hand, expose the anus raising upper buttocks. Instruct patient to breathe deeply and insert thermometer into the anus. 3.5 to 4 cm in adults, 1.5 cm in infants, 2.5 cm in children. Hold the thermometer in place for 1 to 2 minutes. Axillary method. Expose axilla. Wipe it with a small towel. Clean the axillary thermometer in circular motion from bulb to stem by soapy swab, wet swab, and then dry swab. Shake down thermometer till mercury level comes to 35 degrees Celsius or 95 degrees Fahrenheit. Place the bulb in the center of the axilla. Place arm tightly across chest to hold the thermometer in place. Hold thermometer in place for 3 minutes. Clean the axillary thermometer in circular motion from stem to the bulb by soapy swab, wet swab, and then dry swab. Assessment of pulse. Checking pulse rate, rhythm, volume, etc. for assessing circulatory status. Procedure. Explain the procedure to the patient and check if the patient had been involved in any activity. If so, allow the patient to rest for 10 minutes before taking pulse. Select the pulse site. Assist the patient to a comfortable position. Radial pulse. Other sites for checking the pulse. Temporal pulse, carotid pulse, apical pulse, brachial pulse, femoral pulse, popliteal pulse, posterior tibial pulse, dorsalis pedis pulse, ulnar pulse. Assessing respiration. Monitoring inspiration and expiration in a patient. Ensure the patient is relaxed. Assess other vital signs such as pulse or temperature prior to counting respiration. Keep your fingers over wrist as if checking pulse and position patient's hand over his lower chest or abdomen. Observe one complete respiratory cycle, inspiration and expiration. Assess rate, depth, rhythm, and character of the respiration. Monitoring blood pressure. Check physician's order. Explain procedure to the patient. Wash hands. Assist the patient to either sitting or lying down position. Position the sphygmomanometer at approximately heart level of the patient, ensuring that mercury level is at zero. Take soapy, wet and dry swabs and clean earpieces and diaphragm. Select a cuff of appropriate size. Expose the arm to make sure that there is no constrictive clothing the placement of the cuff. Apply the cuff approximately 2.5 cm above the point where the brachial artery can be palpated. Connect the cuff tubing to the manometer tubing and close the valve of the inflation bulb. Palpate the radial pulse and inflate the cuff until the pulse is obliterated. Palpate the brachial artery and place the diaphragm of the stethoscope slightly over the brachial artery. Raise the mercury level 20 to 30 mm of mercury above the point of systolic pressure. Release the valve of the inflation bulb so that the mercury column falls at the rate of 2 to 3 mm of mercury per second. When the first sound is heard, the mercury level is noted. This denotes the systolic pressure. Continue to deflate the cuff, and when the sound disappears, note the mercury level. This is diastolic pressure. Deflate the cuff completely. Remove the cuff from the patient's arm and disconnect the tubing. Ensure that the patient is comfortable. Thank you.